Now, we did a physical examination with her along with our attending physician. We noted that there was bilateral lower limb weakness, more on the proximal lower limbs. So 3 out of 5 proximally and 4 out of 5 distally. We found out that there is absent lower limb reflexes. And on the cranial nerve examination, we found that there was peripheral vision loss with impaired ocular movements, with alteration but maintained class performance. Okay, so in terms of her laboratory findings, we checked her vitamin levels, okay, and we found out that her vitamin B1 was low. So it was 9 instead of being between 28 to 85. Also, we found out that vitamin B9, B12 were elevated, but this was most probably due to the fact that she was taking them as supplements, but without any further monitoring after her operation. In terms of her lumbar puncture, which was done to her, we found out that she had elevated proteins in her CSF, but there was no elevated white blood cells. We did nerve conduction studies for that to rule out any possible reasons for albumin-acidic dissociation, and we found out that it was normal. Then, in terms of the imaging, findings, as you can see on the first image, it shows signs of early cerebral atrophy manifested by the dilation of the lateral sulci on both sides bilaterally. And the second image is MRI, which surprisingly showed an area of hyperintensity, as you can see in the frontal lobe. Okay, so usually patients with thyroid deficiency can have non-specific findings on the imaging. So this is one of the findings that we had. Okay,
at least one episode of BPSD during the disease course. And BPSD in dementia patients usually need some many more attention and care from their caregivers and the doctors, and this is a key treatment target. So it creates a lot of burden for their caregivers. So BPSD are common symptoms. There are usually in 3 domains: the psychological, the affective, and the behavioral symptoms. Among these, the psychological symptoms usually include hallucinations, psychiation, delusion, and affective symptoms like depression, anxiety, irritability, apathy, indifference, and the behavioral disturbance like agitation, aggression, disinhibition, aberrant motor behavior, and so on. And BPSD are common and highly prevalent in dementia. This is a cross-sectional study of more than 1,400 of patients in elderly patients from 33 general hospitals assessed BPSD. We can say that in the dementia patients, the BPSD, the prevalence of the BPSD is more than 76%, and in non-dementia patients, in these patients they cannot call BPSD, but the psychological symptoms and
desire or unsuccessful effort to cut down or control use. 3, a great deal of time spent obtaining, using, or recovering from alcohol. 4, craving or a strong desire and urge to use alcohol. 5, recurrent use resulting in failure to fulfill major role obligations at work, school, or home. 6, continued use despite social or interpersonal problems caused by alcohol. 7, reducing important activities because of alcohol. 8, recurrent use in physically hazardous situations. 9, continued use despite knowledge of having physical or psychological problems likely caused or worsened by alcohol. 10, tolerance needing increased amounts to achieve intoxication or experiencing diminished effects with continued use of the same amount. 11, withdrawal, experiencing characteristic withdrawal symptoms or using alcohol to relieve or avoid withdrawal symptoms. And the severity is classified by the number of criteria met, mild being 2 to 3 symptoms, moderate being 4 to 5 symptoms, and severe being 6 or more symptoms. So then PTSD and AUD often co-occur, and comorbidity raises relapse harm and functional loss. It's also harder to treat AUD after it's established, and prevention can cut the risk of developing AUD in those who experience PTSD. So to determine who is mostly at risk and who needs prevention the most, I took an evidence-based approach and reviewed literature on
large ventricles, brain atrophies, small hippocampus, cortical dyskinesia, Danny Walker malformations, and it is also the related frontocerebral hypoplasia subtypes in the paper. So background of the PTC1 gene, well, it encodes tetratricopeptide repeat protein, and it involved in protein interactions in our body, and it used ROS-MAPK signaling, and it also involves in T-radii pathways, which produce production of proteins. Well, so far, no clinical phenotype previously described in Omen. Aim of the study is describe first clinical radiologic phenotype linked to the PTC1 gene mutation and suggest a novel PCH gene. Well, the meaning is PDOT panel 262. Well, it means there's a mutation in protein location, phenylalanine replaced with valine, and we aim to explore genetic phenotype correlations. 2 unrelated families, but they are consanguineous marriage, Turkish families. One of the families in Diyarbakir, one of the other families in Izmir, which is far away, and we searched for any relationship of their fellow families, but we found out not. There are 4 affected female siblings, and 4 of them has homozygous PTC1 gene mutations, and the other siblings and parents has heterozygous mutation. As you can see on the pedigree,
I started life at 31 years old. After that, founded the Addict Happy program because, like a lot of people who get off speed or stimulants, they fall into depression. I became addicted over into food. And then being addicted to food, I had to learn how to work out and refine who I was. I went from like 155 to almost 300 pounds in less than 4 months. And that was back, this is showing my age. I was on MySpace saying I'm sober a year, and everybody's like, you look terrible. And so I really had a hard time with it, but I am a 7-time Ironman triathlete. I proved that people earned a PhD. We own a CrossFit gym that helps people in recovery and helps offenders, including sex offenders. And we work with teens, not at the same time. So we work with different populations. And so one of the things that we learned is connection, like somebody else said, and exercise can help with recovery. And it also helps with creating pro-social environments, which is really hard for people who've been addicted to drugs for years. And so my presentation is Be Like Water, because when you're working with people who are on drugs and alcohol, you gotta flow with them. You gotta figure out why they're not wanting to change and how come they're not wanting to change. And we can't understand. Somebody had a water bottle yesterday that said harm reduction saves lives. And sometimes that's all we can do is reduce harm. Just like when we're working with people who are addicted to food and addicted to other things, we could just only reduce harm, because abstinence or getting them to stop doing a toxic compulsive behavior can be very difficult.
From healthcare, from dance, from physical therapy, from dementia care, to create really a holistic approach to dementia care. Our leader, Deborah Hogue, is here in the audience, and we'll pull her up at the end. She is the founder of Neurobody Therapeutics and a leader in long-term care underwriting. One of our colleagues who could not be here this weekend, Jonathan Roberts, is a world-renowned dance educator and really is key to the curriculum and the dance components of the curriculum. It's wonderful collaborating with him. And then Dari and I bring in our therapeutic expertise. So my name is Dr. Laurel Daniels-Abrazizi. I am an associate professor in the Department of Rehabilitation and Regenerative Medicine, which is part of Vagilis College of Physicians and Surgeons at Columbia University. So I teach geriatrics, I do dance-based research, I do research with older adults, and I'm also a certified exercise expert in older adults.
We have this critical window to intervene, and this is a period called mild cognitive impairment, or MCI. So MCI is where we see declines in memory, attention, and other cognitive functions more than normal aging. And interventions at this stage, when someone has mild cognitive impairment, can be very beneficial in preventing further neurodegeneration into dementia due to neuroplasticity. That's in our brain, it's the ability of dendrital or neuronal connections. So that's a critical element. So I will be presenting the key evidence for slowing decline, and it is possible to slow this decline as we age based on mounting research on interventions that combine movement, music, social engagement, and the benefits are seen across 3 domains of health, including cognition, physical.
Neurologist working. Headache for neurologists is always not just headache, it's more than that, and we will be really concerned when it's something related to thunderclap headache or some red flags, but will be truly relieved and feeling safe if it's only a primary headache like migraine. So I wanted to resist this idea, but actually I did it. And let me go through another way of introducing my topic by saying that migraines are nature's way of reminding you that brain tissue has feelings too.
Now we see similar results among the predictors of depression. This was also significant. Only here there was not significant sex differences. Again, people who were younger were more depressed than those who were older. Those who had the doctors were significantly more depressed than others. Those who were doing and those whose income had been affected were more depressed than the others. Now, if you look at all this, this gives a very depressing picture that everybody was anxious and everybody was depressed. But there was something good which came out of it also. So we had, during the first wave, we had some people on and some people off. So we had some times when we were doing duties. So we were doing duties for 15 days in a stretch. And then for the remaining 15 days, we had time with our families at home. So we found that many people actually caught up with research work, they caught up with their studies, somebody did online studies. In fact, during that time, I started doing a fellowship in headache medicine, and over the next 2 years, I did an online fellowship. So that is when the online piece came up. Before that, we had to attend every conference going.